Vanakkam makkale, myself Pugarendi, and today we are going to see about the thoracic spine, which forms the middle part of your entire vertebral column, and the thoracic spine extends from T1 to T12. Thoracic spine is generally designed for stability and not for mobilities. Hence, it has very less range of movement available in it. And there is one more peculiar thing about the thoracic spine is it has so many other joints or other structures surrounding it. See, when you think about the middle part, it is not only the spine as like cervical and lumbar. You see, you have the rib cage, you have your sternum, and you have two scapulas. Like it forms a thoracic spine becomes one of the structure forming the entire thoracic cage. So obviously the mobility is sacrificed, and you have like stability is the major part. So to see the movements of your thoracic spine, you see only this much is available. I am showing you the isolated movements of your thoracic spine. Only this much is available. Every range in all axes and planes, it is only around 5 to 10 degrees of movement which is available in the entire thoracic spine. So mostly we don't do a thoracic spine exercise in an isolated way. Always it comes in combination with your lumbar spine. We do the exercise for the entire trunk, not isolated. But why I am saying now about isolated thoracic spine segment is it depends upon the condition and pain, okay, and if it is required, then you can do it in an isolated way. See, now I'll tell you the exercise of the thoracic spine. The first one is take it up, then come to the neutral. It will be around 5 to 10 degrees, not more than that. Bend back. I am doing it isolated for your thoracic spine, then neutral, then forwards, isolated. This is 2. Okay, come to the neutral. Breathe out, breathe in. Always include or incorporate breathing exercise or breathing pattern in all your exercises. So breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in. Then comes the rotation. Breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in. Only this much movement, or these are the movement available isolatedly for thoracic spine. Okay, and hence we have talked about thoracic spine, and I have told you there are structures surrounding the thoracic spine. We have two scapulas which is gliding around your thorax. When you do the exercise, you have to consider those two joints also. They are pseudo joints, they are false joints, they are not real joints, but still you have to do the mobility exercises for those joints, and that is this one. We generally call that as shoulder shrugging exercises. So we will do this. Breathe in, breathe out, move the scapula, the blades up, breathe in, breathe out. This is how the scapula of mine is moving now. Breathe in, breathe out. Okay, then actually breathe in, breathe out. It should be full. Breathe in, stretch your sternocostal joints here, stretch these joints and constrict those joints in the behind. Breathe in, the vice versa, breathe out. So this is about the accessory movements of your thoracic spine. Okay, so when you do all these things, almost we have covered the structures of your and the thoracic spine and the surrounding structures. You have covered the active range of movements. As we all think, okay, that's all, it is all over. Major people think that okay, it is all over. No, the main important exercise which covers your thoracic spine is your breathing exercise, because as I said you, all these ribs go and attach with your vertebra, thoracic vertebra. So without finishing your breathing exercise, the thoracic spine exercise is never complete. So you have to do your breathing exercise also. It is not a major like a complex one. Just sit in one corner with cross leg or high sitting. Advisable is cross leg sitting. Okay, then breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Simple breathing exercise. Okay, and hence I have said about breathing exercise, it's all a different very interesting part of exercise thing. So for breathing exercise we'll put an all good episode, maybe like the 6th one or 7th one for the breathing exercise. But with this, the thoracic part is over, and for lumbar, please wait for the next episode. And makkale, please take it into your mind, exercise is a creative form. Okay, you can find your own exercises, you can make your own exercises till the point that you are having a normal joint without pain or dysfunction or any other traumatic damage. Till that point you can do any self exercises as you wish. Okay, but if there is a problem arising and it is disturbing your function and it is giving you pain and there is a history of trauma, and then you have to go to a health professional, get yourself diagnosed and make an exercise prescription, then it is advisable to do all the exercises. So I myself, I am dividing the things into two, normal and affected. So normal, you can do all the range of movement exercise. See if this is your range of movement, and that will be the exercise also, only the resistance varies. Otherwise you can do all the exercises for any joint. Okay, thank you makkale, and wait for the 5th episode, and that is about your lumbar spine. And hence I have said you about thoracic spine. Thoracic and lumbar, always the exercise goes together. So in the next episode I will tell in detail about the lumbar or the thoracolumbar together. Okay, thank you.